Ladies and gentlemen, please welcome our moderator, Director, the Hutchins Center on Fiscal and Monetary Policy, Brookings Institution, David Wessel, and his distinguished panel.
Thank you. It's good to be here, and I'm always particularly glad to do things with the Peterson Foundation, which, warning, this is a plug coming up, which was very generous in helping to support a little project we had at the Hutchins Center to build a computer game on the federal budget called the Fiscal Ship, which is available free online, and there's a couple of iPads out in the lobby where you can try it for yourself, and we're happy to receive your complaints afterwards. We've discovered that that's one thing about doing an online game. You learn a lot about what people don't like about what you assumed in the game. I'm really pleased to be joined today by Mark Hugo Lopez from the Pew Research Center, Robert Doar from the American Enterprise Institute, and Heather Boushey for the Center on Equitable Growth to talk about something a little different than the panels we've had earlier today. We're going to talk about demographics, and you might wonder, well, how did demographics find its way into the annual Fiscal Summit, another plug. And the answer is pretty simple. When we think about the debt, the federal debt, we're thinking about the debt measured against the size of the economy, the GDP. And when we ask the question, what is driving the debt, it is greatly related to the demography of America, the aging of the population, and our ability, what we are going to spend on in the future, and what our capacity to get revenues from workers and business in the future, that is related to demography. But also, the denominator, the size of the economy, is very much a function of how many people we have, how many of them work, how productive they are. So thinking about the demography of the United States is actually, has two reasons it's pertinent to this conversation. One is because it does tell us a lot about what debt to GDP ratio we'll have and how it will be sustainable. And it gives us advice about what do we need to do today to be a more productive society so we can pay the cost of having an older America. But secondly, the whole notion of shared sacrifice, of political coming together, that's all very much related to what the demography of the country is. And when I say demography, I don't only mean the age of the population, I also mean the diversity of the population. Because we know that America is becoming much more diverse. The fraction of people who will look like me 40 years from now is going to be less than it is today. And that's an important political thing. But also, demography has this wonderful advantage compared to everything else we've talked about today, is we can be reasonably sure about our projections. I mean, we had a whole conversation here trying to guess when will we have a crisis in the financial markets that will then force the government to do something about the debt. And the answer basically was, if you cut between all the BS, who knows, right? Well, we know how many people are going to be in America 20 years from now because they've all been born. I mean, we have some interesting questions about what they'll look like and how many will be immigrants. So the Peterson Foundation, and working with the Ford Foundation, has started a project, we call it US 2050, to sort of lay the intellectual foundation for asking, essentially, what do the demographics of the United States, both in terms of age and ethnic diversity, what are the fiscal and economic implications of that? And the three people up here are among the people on the advisory committee we formed to help guide this project. And we've just commissioned 31 academic papers on aspects of this, ranging from patterns of labor force participation by ethnicity, patterns of caregiving among different segments of the society, what the racial makeup of state legislatures says about the policies they pursue, about the forces that are determining how many people want to immigrate to the United States, about the differences in education, both who goes to college and what returns they get in wages, depending on their group, how family structure matters, a whole range of projects. We are not going to summarize 31 papers here today, and basically none of them are written, so we couldn't anyways. Yeah. But what we're going to do is talk a little bit about why would a bunch of people who worry about the debt think that demographics was so important that we should spend 45 minutes this morning thinking about it. I'm going to start with Mark because Mark is going to help us think a little bit about, remember, what are a few of the salient demographic facts that will shape what America looks like over the next 2 or 3 decades.
Great introduction, David, and thank you for making the point particularly that we know to a good extent what the nation's population will look like in 20 years. And I think perhaps one of the most important points there is we've recently seen that among those under the age of 1, for example, recently born babies, you have a population that's majority non-white. That's essentially what the U.S. population is going to look like sometime mid-century, but we know that that youth cohort is going to be an important part of the group of young people going to college 20 years from now, and also entering the workforce, say, 25 years from now. So we really got a good sense of what that demographic population is going to look like. Now, it's of course possible that many things could change. And when you talk about population projections, I would say that while we have a good sense of what we'll be 20 years from now, we also have to keep in mind that things can change quite substantially. And in fact, population projections can be very different in 10 years from now than they are today. And to give you an example, 10 years ago, we were saying the U.S. would be majority minority population sometime in the early 2040s. But with the slowdown in immigration, that date's been pushed a little farther into the future. And that's an example of one of the changes that can happen right away. But what's happening today? Well, the U.S. is a country that's become more diverse, largely because of the Immigration and Nationality Act of 1965. That opened the door to a change in the composition of the country as both Hispanic and Asian immigrants came in large numbers to the U.S. over the past 50 years. About 59 million people, by the way, in total have entered the U.S. since 1965 as immigrants. That's had a big impact on the demographic, the racial and ethnic composition of the United States. Today, for example, 18% of the population is Hispanic. Back in 1965, it was only about 4% Hispanic. We project that about by 2050 or so, it'll be almost 29% Hispanic. So Hispanics are a big part of the nation's changing population characteristics. They're actually the main driver of population growth. Asian Americans are actually the fastest growing group among the largest racial and ethnic groups, and they're also projected to be almost about 15% of the U.S. population by mid-century. So these are the two groups that are growing the fastest. They're not the largest, but they're growing the fastest. They're also, at the moment, the two groups that I think are important for our conversation, because when we talk about who's entering the job market today and who's going to be the big driver of job market growth, the number of workers in the country into the future, Latinos are a big part of that story. Asian Americans are a big part of that story. Immigrants are also, future immigrants are also potentially a big part of that story. Now, these groups have different characteristics. For example, with Latinos, you see a growing number of U.S.-born Hispanics going to college, many choosing a 2-year over a 4-year institution, but nonetheless, you see them going to college in record numbers. That bodes well for perhaps having a better educated workforce in the future than might have been expected given the characteristics of Hispanic workers in the past. What about in terms of Asian Americans? Here, there's a lot of diversity. On the one hand, you have some groups that are very well educated. Immigrant groups, for example, Indians and Chinese who have PhDs or masters or some sort of a professional degree. By contrast, some other groups have much lower levels of education. And so there's a big diversity within the Asian American community in terms of education. But I think the story of education and how prepared these groups are going to be important for determining where the labor force goes and how important that's going to be important in driving what we see in terms of tax revenues, in terms of success, in terms of earnings. All of this is going to be important for providing a background for where the U.S. will be in the future in terms of its budget situation. So that's, I think, an important point to note. Now, one other thing I think that's of salience here is immigration. On immigration, we've seen a slowdown in immigration coming from Latin America. But you should know the U.S. still is the world's leader when it comes to attracting immigrants. Even if there are many policy changes that might reduce the size of the legal inflow to the United States, which, by the way, is about 1 million people enter the country legally every year, it's likely that we will still be the world's leader in terms of attracting migrants. That means the U.S. oftentimes is getting sometimes the best and brightest of many different parts of the world, or people coming here to study and ultimately staying here to pursue careers here after being trained in the United States. So that's another potential source, and frankly, an unknown about where we will be in the future. So that's
Thank you. So, Robert, I think it has to be true that if we have lots of poor people, that means there'll be lots of demands on the government to help them, and they obviously will be less, making less money, probably be less productive workers. There'll be less revenue to pay the burden of an aging society. So I wondered if you could talk a little bit about, help us draw the link between what do we know about poverty and the patterns of poverty, and how does that relate to kind of the fiscal future of the country?
Well, it's a good opportunity to talk about long-term trends instead of getting sort of caught up in the day-to-day battles and the various safety net programs. And I come from running the anti-poverty programs in New York State and New York City, and there are 4 things that I am struck by that are happening, that are changes that I didn't really anticipate. And the first is there are fewer kids. There really has been a decline in birth rates and a huge decline in teen pregnancy rates. And that's an issue because we'll have fewer earners. On the other hand, it could be an opportunity because we may have additional resources to devote towards struggling kids on a per-child basis. So, but that is definitely happening. And I'm not exactly sure what is driving it or what it means, but it's definitely a fact. The second is immigration. I come from New York. We are an open city. We are a lover of immigrants. But it is not, it is also true that the safety net, demands are made on the safety net by immigrants who come here who are in need. We stepped up to it and we were ready for it, but it's not an unsubstantial thing, and it needs to be recognized. The third is marital status and the extent to which children born into households that are born led by a single mother without a present other parent there for the long haul are more likely to be in need of assistance and face challenges. Right now it's about 40% in the country. It's an issue for all races or most races. It's more children are born to white families and single parent families than blacks every year. But it is a factor that contributes to the way we address poverty, and it's also there's a huge division by education. So highly educated women normally have children inside marriage, and educated women who are high school education or less often do not. And that's a big issue. The last one is, you know, I'm from the crowd that used to always say that we do an awful lot for middle class and upper class seniors, and we're not doing enough for children, and I would sort of get into that generational equity issue. But I, of late, have begun to worry a little bit about a portion of the senior population that don't have enough hours work and earnings and are really not being adequately cared for through the Social Security system. Andrew Biggs, my colleague at AEI, has written about this. I think that's going to be an issue for us that we're not facing up to yet, and that's going to result in a greater demand along with all the other demands that come with. So when I used to say that we need to move families from the dollars investments from well-off seniors to poor kids, I now think we need to move some dollars into poor seniors as well. So those are some demographic factors that we watch carefully, and it is changing the nature of poverty in the United States.
So the nature of poverty is changing because we have more older people who are poor, fewer kids?
I think the kid issue really is, there is aspects of where the numbers are not as great as we anticipated. And of course, I'm so gratified to hear that we're still the immigration capital of the world. I mean, that's just the best news I've heard in 3 months. It's
a low standard, I'm afraid, these days in Washington. Heather, Robert nicely opened up the question of inequality. And I wondered if you've spent a lot of time thinking about this. One of the things we know is that by almost every measure, the U.S. has become more unequal, wealth, income, so forth, over the last couple decades. And I don't see any particular reason to think that trend's going to change. To what extent does that affect the rate of growth of the economy and how we think about this fiscal burden?
Yeah, thank you. And these are great comments to follow. It's great to be here today. So let me actually get to inequality by starting by talking about growth and productivity, which both of you sort of focused on a little bit in your remarks, that if we want to have the kind of economy that is growing in the future, we need to be seeing productivity gains. That's really the way that we see the kinds of improvements in living standards over time that improve our standard of living across the country. And I was really struck in the handouts that are in the packets that the Peterson Foundation gave us, that there's one chart that shows that in the future, we're going to have fewer workers per every retiree. And so we should be really worried about this. And we should be especially worried about this if we're not seeing productivity gains between now and when those workers are going to be supporting those future retirees. Because what's going to make or break the living standards of the elderly is how productive those current workers are. So the question then is, are we doing what we need to be doing to make sure that we have future productivity gains? And unfortunately, the answer is no. Right? The United States is falling behind other countries in terms of our outcomes, in terms of educational attainment. We are not the country that has the best and brightest in terms of where kids are when they graduate from high school. And we're not making those investments in early childhood education, which we now know are really where you can get the biggest bang for the buck. And a key reason why we're not seeing those kinds of outcomes that we'd like to be seeing in terms of the potential for future productivity gains based on how well we're educating our children is because of inequality. So you see these really big differences across communities and across families in terms of access to education, access to the kinds of early childhood care and pre-K that can really make a difference for where kids are. And all of this is cumulative over time. So when a future employer or a future someone who, a financial market person who's looking for that really smart person who's got a lot of skills and knows what they want to do to create the better mousetrap or to be that really highly productive worker, we are not seeing the investments today that are going to make that possible in the future. And inequality, of course, plays a big role in this. Let me just give you one stat around inequality that I find very compelling. Raj Chetty, and actually he presented this work at Brookings a few months ago, I think, David, you were there, did this research that we were happy to invest in at Equitable Growth, looking at who gets patents and what the connection is between your experiences as a kid and your skills and talents as a child and whether or not you grow up to get a patent. And he found a couple of things. One is that if you're a smart kid, you're more likely to grow up and get a patent as an adult. That makes sense. And by smart kid, these are like third grade test scores. But what he also found out is that when you look at those third graders, and once you know what kind of family income they come from, so they match data on third graders or children in primary school with their parents' income, and then looked at whether or not they got a patent as an adult, lo and behold, it was the smart kids from rich families that grew up to get patents, and smart kids from not rich families, not so many patents. And in fact, if you really want to know what's going to create that growth in the future, that is one of the most disheartening statistics. So are we making those investments across the income distribution to make sure that kids from all kinds of families can grow up to be the kinds of workers and future innovators we need them to be?
Thank you. Robert, can you talk a little bit about public investment? Do you subscribe to the idea that we are not investing enough?
No, I don't actually.
I thought that would be.
Completely. And I certainly don't if it's sort of a desire for universal early education or universal pre-K, because I worry that it's not just the way we invest or the amount we invest, but it's how we run the programs and how we address the particular needs of the most poor. So I'm completely with you that we don't do a good enough job with really struggling families who face serious burdens, and I'm a big supporter of targeted interventions to help them get a better start. I worry, especially considering the fiscal pressures on us, that we would spend a whole lot on an investment that isn't as wise and as targeted and as evidence-based, and not really get the results that we need for the populations that are lagging behind. So, I think Diane Schazabach and Hilary Hoynes have a paper out that looks at what we've done in anti-poverty programs over the years for children, and it really is, it's not a lot, it's a lot. We do quite a lot. We did more this year. We increased the child care block grant, almost doubled it, and not one of my favorite policies, but we increased the refundability of the child tax credit back to families, including poor families. So it's not so much how much, it's how effective. And I think we have opportunities to be more targeted, more wise in ways we help struggle.
So what would you do differently? Give me an example.
Well, I'm a big fan of what has happened in the charter school movement in the best performing charter schools, especially in New York City. I think Eva Moskowitz is a great hero. I would allow more of that and not be against more of that. I definitely would support expansion of nurse-family partnership interventions for very poor families. I don't think anyone who's really thought about that disagrees with that. But I would not mandate or have the federal government put a big footprint down on universal pre-K, because I think the cost-benefit analysis isn't very good.
Heather?
Well, so we did some of that analysis at Equitable Growth a number of years ago and found that if you implemented a voluntary but universal access, kind of like we have here in the District of Columbia and other places, New York City, for universal pre-K, it would pay for itself in 8 years, and it would increase GDP in the future demonstrably.
How would it pay for itself in 8 years if the kids are going to be like 10 years old in 8?
Yeah, that's a good question. Based on the
Equitable growth calls for child labor.
Yeah, exactly. I think that's definitely how we did that. I think that the idea being that those investments, what we're going to see in the future productivity gains, would be paid for within the first 8 years of the program, not that those children would be doing the labor. Good point, though, David. Thanks for calling me out on that. But that these investments, one of the things that we know is, a couple of things. One is that the vast majority of families now no longer have a full-time stay-at-home caregiver. We know that one of the most important stresses on families, which is also connected to their ability to be good workers and participate in the labor force, is access to the kinds of policies like affordable, high-quality education, connected with universal pre-K, connected with paid leave and other policies that allow people to get to work and make sure that those early years, children are getting those investments that we need. The United States now has a lower labor supply than most of our economic competitors in the OECD for both women and for men. And economists will tell you that this is because, especially for women, because we haven't made these investments in policies that allow people to get to work. So I would like to respectfully disagree that this isn't just about poverty, and it's not just about kids in need, very important as though they are. It's about making sure that parents can get to work and know that their kid is in a high quality care that they can afford. And most parents, many of us in DC notwithstanding, most parents still have, or at least women, have their first child before the age of 26. Which is when they're earning the least that they are in their career. Many of them also have student debt. They can't afford to spend the kind of money that they need to on these early childhood programs that they have, even families that might be middle class. And of course, let me just add that we know, yes, that these millennials, the people who are going to be the future ones paying for our retirees, are on a trajectory of income that is lower than previous generations. So they need us to be making those investments in their families. And I think it starts with early childhood.
So you're making two different arguments,
yes,
which I think are both have. One is you think we could invest in the kids and they'll be more productive workers. And the second issue you're raising is if we have more childcare, we'll have more labor supply, and that will, so I think they're both significant. Mark, I want to turn a bit back to immigration.
Sure.
So I think there's a kind of popular view that we need a lot of immigrants because they come here at working age and then they must go back to Costa Rica when they retire. So help us think a little bit about what do we know about the life cycle of immigrants, and is it true that immigrants also get old?
Yes. It's a great question. One of the other arguments you oftentimes will hear is that the U.S. has benefited from immigration demographically by lowering the median age of the U.S. And that's true compared to other countries like, say, Germany, Italy, or Japan. And Japan doesn't accept many immigrants. Germany accepts a lot, but it's an aging society. And Italy is a country that you're going to start seeing its population start to decline, if it hasn't already, with such a low birth rate. But here in the U.S., with immigration, we've had a little bit of a demographic bonus. I would say, though, that we got to be careful, because immigrants, too, do get old. They also have children that have families with fewer children than their immigrant parents had. So as time goes by, these generations of immigrants start to look more and more like most Americans. Now, your point of, do they go back home? Well, we are starting to see at the moment a return migration for Mexicans back to Mexico. At least more seem to be leaving the United States and coming to the United States, although that may be changing. We're waiting for some new data to find out if the U.S. economy's good position is sort of attracting more people. But many of those Mexicans who return home are returning home after many years working in the U.S., 20, 30 years in the U.S., and they say they're doing so to be with family. So it's possible we may see some migrants who've come here leave the U.S., but that doesn't mean, especially if they get U.S. citizenship, that they won't be drawing on things like Social Security. So it's interesting that we have this very interesting dynamic happening, and perhaps the U.S., with all the immigration we've had, has delayed the demographic challenges of some other countries, but it doesn't mean we aren't going to have them in the future.
Interesting. Robert, there was some discussion earlier today about how big healthcare spending figures in the fiscal outlook, which is obvious to anybody who looks at even the top line numbers. How do we think about the changing demography of the United States and what it'll do to healthcare? What role does Medicaid play in this? We often talk in this circle about Medicare.
Yeah, well, so Medicaid is our healthcare program for the poor, and so since I work in poverty programs, it's the huge elephant in the room. It's bigger than all the rest combined, and it has a whole different interests that protect it and support it. I used to say when I was testifying in state legislatures on child care or early learning, it would be me and a few scruffy advocates. But when it was on Medicaid, it would be me and the most powerful lobbyists in the state, because they are representing the healthcare industry. To me, all that really says is that it soaks up so much, and that if we could find a way to reduce the cost of healthcare, we could free up dollars to help struggling Americans in more effective ways, and devote more in investments in early learning and child care. But and Republicans make the mistake of always saying that look at all this money we spend on the poor, and they put the Medicaid in there so we get up to the $800 billion trillion figure. But another problem with that is that all no struggling American is spending that. They don't have it in their back pocket.
Right.
And poor people don't really rip off the Medicaid program. Actually, healthcare providers rip off the Medicaid program. And so my view is that it's a program that still is ripe for change in a way that could help struggling Americans.
Interesting. Heather, how would you deal with the healthcare thing? Do you look at it as an investment? We're getting healthier workers, we should just keep spending? Or do you think that this is really a different kettle of fish?
Well, I would look at it as an investment. There is a lot of new research in economics and in other, wider range of disciplines focusing on how important actually health is to future well-being of people. Crazy idea, right? But one of the things that they found is that what actually happens to us in the womb, you can see differences across income and unequal experiences that people have that follow people for a lifetime. And that's a really important fact and a really important one for Medicaid and for the CHIP program and other investments we're making in women, infant, and children, and young families more generally. So if you can trace the differences in an experience that a woman has when she's carrying a child to that child's outcomes when they are in high school or when they're 40 years old, which economists have now been able to do, then those investments actually they're important in and of themselves for all the reasons that Robert already identified, but they're also important for our future productivity. I mean, there's some very basic, simple stuff here, which is that the investments that we make in people, especially in young families, really are some of the most important investments that we could be making. And of course, the other thing about Medicaid, if I'm not mistaken, is that those kids and those young families aren't where all of the costs are. A lot of those costs for Medicaid really are coming because it's folks at the later end of life. Yeah, because we haven't actually solved that problem. So let me add a little layer to that, which is that we're not investing enough in home health aides. We're not investing enough in making it possible for people to age in place in communities where they have the supports that they need. And too many families end up having to rely on nursing homes, which are completely impossible for families to pay for on their own. So we've created this weird system where, because we don't want to make these investments that are really cheaper and you get a bigger bang for the buck, you end up with these much more expensive problems later on. And that's not just a poverty problem. I mean, I'm sure that many of you in the audience and many of us up here also have to deal with elder care issues, which not only pulls people in their prime out of the labor force to care for an aging family member, but has this enormous expense.
The only thing I would add to that is that Medicaid health care coverage provides security and the benefit of knowing you have somewhere to go to pay for your health care when you need it. Medicaid health care is not the same thing and isn't as good as the security. And I think there's a whole nother, and it's where it might be particularly good is in the care for women who are about to have children and in the early years. But for other health care issues, Medicaid really it's unclear as to how much it's helping people improve their health status.
Mark, what do we know? One of the things that we're asking in this project, because I think it's really important, is how will family structure, patterns of behavior differ in the future, because different ethnic groups and different cultural groups behave differently. You mentioned a little bit about college. Do we know much? This is not rehearsed, so I don't know is an acceptable answer. Do we know much about how patterns of caregiving of the elderly differ across the population?
Yes, we do. I don't know the numbers off the top of my head, to be honest, so I can't quite answer it exactly, but there are some differences. And if you think about anecdotes of, say, the story for a Latino family, you oftentimes do see the Latino family is oftentimes a multi-generational household. People are taking care of both up and down.
More than, say,
than the general public. We've also seen in the U.S. a growth in the number of multi-generational households in recent years. Partly that's been young millennials coming back, living at home, and not necessarily after college going out and finding a job and living on the recession had something to do with that. But also, it's perhaps a reflection of some of the immigration patterns that we've seen coming into the U.S., where many Asian American households, for example, are multi-generational households.
I think we're going to have to face up to the issue of elder care and responsibility for the family and the government and where that line is. And I think that I ran the home health care aid program in New York City, and it's a hard one to run well and to do it in a way that provides the right amount of care at an appropriate cost. So I think that that's a significant issue. There's one other thing I want to mention that ties it to the previous session.
Please.
Is that one thing I've learned in studying the poverty populations and low-income populations in the United States is that consumption data about the resources available in their households, this is true of everybody, is greater than income data. And I do think that, the last session and this session is so depressing about the burdens of coming down on us. There is one solution out there, and it is to turn our attention toward some sort of taxation on consumption, that where other European countries have done so and produced significant revenues that have allowed them to absorb greater burdens. And all I add to this discussion is that there's more consumption than there is income. And
if you look at the data.
If you look at the data.
Somehow people are spending more than.
And that seems to me to reveal something that is worth considering.
Well, okay. I'm not sure which of you should take this question, so it's a jump ball. It seems to me that it's often said that the growth of the economy is the sum of productivity growth and labor force growth. Yeah. But of course, the fraction of working age people who work is also really important. And Heather, you noted that the trend in the U.S. has not been, except a little bit recently, in the right direction. Robert, maybe you could take this. What do we know about differences in labor force participation across the population? And do we have any idea how to make it easier for people to work in addition to what Heather pointed out about child?
Well, the big story is men, and men have dropped out of the workplace before. Prime age men, and there's some cause for that by virtue of the wages have stagnated and the attractiveness of work has gone down. Manufacturing jobs. There's a great paper about the effect of the decline in employment in manufacturing on male employment, and you know that's kind of rational. If you were making 22 and now you're going to make 8 or 10, you might stay out of the labor force. Disability growth is also a problem. I have some issues with the way we evaluate people for disability and the fact that we condemn someone to the rest of their life to not working when actually they'd like to work and could work in other things. And then the combination of various forms of assistance, all tiled up, make it, as some would say, they finance non-work by allowing people to receive benefits and not work. And that's where the sort of making the food stamp program or the Medicaid program be more willing to not just be focused on enrollment for work-able adults, but also say, can I help you or push you?
But on the first part, do you think then that sounds like a policy prescription for some sort of wage subsidies or something at the low end?
Right. Wage subsidies for childless adults would obviously be one of them, but I also think a little bit of attention to employment for non-working recipients of various forms of assistance is worth the effort.
Heather?
Well, and I mean, one of the challenges, of course, for families, if they are receiving benefits, be them food stamps or Medicaid or even the earned income tax credit, is that the implicit tax rates, as they earn more money, they get that job making the minimum wage, and then they get that $2 an hour raise, but 100% of it or 110% of it is being taken back, the numbers I'm making up. So whatever it goes to.
That's a very high marginal.
There are cases, though, certainly where some of those jumps are over 100%.
There's a cliff.
Right. There is definitely a cliff, and I actually
especially in childcare.
Especially in childcare or with housing. If you are in public housing and then you lose your housing or your voucher, that can be a big jump. But childcare or going on or off Medicaid, also big jumps where you can't afford them. And so one of the things that we've not spent enough time thinking about is what is it that we need for people to be actually able to be in work and to stay in work and have what they need so that work pays. So, I mean, again, I think it's childcare. It's also making sure that they have access to affordable health care and affordable housing, but making sure that we're not just sort of saying you've got to work, but that you're making sure that they have the supports they need when they are in the workforce. And then just one other small thing, while it is true that the big story, of course, over the past 40 years or so has been the decline in male employment, really since the 2000s, men and women's trends have moved together. They've moved in tandem, except for during the drop-off during the Great Recession when men have bounced back from that. But they've both moved in tandem, and they've also moved in tandem on the increase in both men and women on the disability rolls, starting from a different level. But this is an economy-wide problem for both genders, and a lot of it has to do with, I think, the things we're talking about today.
Right. I always get a little nervous in these conversations about prime age men. Since I long past 54, I think we've got to come up with some new language for this. So we're going to bring this conversation to a close here, but I think what we've tried to demonstrate here is really two very simple things. One is you can't think about the debt to GDP ratio without having a clear understanding about the demography of the country, the changing age profile, and the changing diversity of the country. And the second thing is that increasingly talking about averages is going to be misleading. And I think too many of us fall into the trap of thinking that the typical family is like ours. And as we become a more diverse society, no matter what happens with immigration, we're already destined, as Mark pointed out, to become more diverse over the next couple of decades. We will see that averages can be misleading. Different groups of the population will have different behavior about college going, about work going, and about caregiving. And so part of the point of this project is to kind of put some hard facts and analysis onto those things so we can have a better understanding going forward, because the decisions we make today on these social programs, on investments, are going to have huge implications 20 years in the future. So we really need to know what we're doing. With that, I'd like to thank the panel and thank you for your attention.
Great.
And I'm hoping that someone other than me the voice of God is going to descend and tell people what they do next. But I notice there's lunch in that direction.
Great job.
Thank you.